Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. The disease progresses through multiple stages, starting with sores and rashes, and potentially leading to severe damage to internal organs if left untreated. Awareness of the disease helps with early detection, timely treatment, prevention of transmission, and reduction of complications. In recent years, the number of syphilis cases has increased significantly. In 2022, approximately 207,000 new cases were reported, marking a 17% increase compared to 2021 and reaching the highest level since 1950. Even more concerning is the rise in congenital syphilis cases, with over 3,700 reported, resulting in 231 stillbirths and 51 infant deaths. The main causes of this increase include drug use, unprotected sexual activity, and a decline in condom use. Additionally, a shortage of sexual health clinics and specialized doctors has contributed to the situation. The limited availability of essential treatment drugs, such as benzathine penicillin G, has further complicated treatment efforts. The Treponema pallidum bacterium enters the body through small cuts or mucous membranes during unprotected sexual contact, vaginal, oral, or anal. The disease can also be transmitted from mother to child during pregnancy, leading to congenital syphilis. Because the bacterium cannot survive long outside the human body, syphilis is primarily spread through direct contact with an infected person. The disease progresses through several stages. In the primary stage, a painless sore appears at the site where the bacteria entered, typically on the genitals, anus, or mouth. Even after the sore heals on its own, the bacteria remain in the body and continue to spread. The secondary stage includes symptoms such as rashes, genital warts, fever, muscle pain, and swollen lymph nodes. The disease then enters a latent stage during which no visible symptoms appear, yet the bacteria continue to cause internal damage. If left untreated, syphilis progresses to the tertiary stage, which can result in severe complications such as memory loss, loss of motor coordination, blindness, joint and muscle pain, and cardiovascular damage. Syphilis can be effectively treated if detected early. However, many people are unaware of its symptoms and risks. Raising awareness through health education encourages protective measures such as condom use and regular health checkups. Mother-to-child transmission of syphilis during pregnancy is a serious concern. The bacteria can pass through the placenta even if the mother has no noticeable symptoms. Without treatment, the risk of miscarriage, stillbirth, or premature birth increases significantly. Approximately 40% of pregnancies affected by syphilis result in stillbirth or premature birth. Newborns with congenital syphilis face severe complications, including malnutrition, breathing difficulties, developmental delays, and damage to the skin, bones, and internal organs. Syphilis situation in the United States. According to the Centers for Disease Control and Prevention (CDC), the number of syphilis cases in the United States has risen significantly in recent years. In 2022, more than 207,000 cases of syphilis were diagnosed, marking a 17% increase compared to 2021 and reaching the highest level since 1950. However, specific data on syphilis cases in the US for 2024 is not yet available, as such information is typically released after a certain period to ensure accuracy. To access the most up-to-date statistics, you can visit the official CDC website or consult other public health agencies. The prevalence of syphilis in the United States is increasing, particularly among high-risk populations. According to CDC reports, men who have sex with men, MSM, account for a significant proportion of syphilis cases. In 2021, MSM made up approximately 50% of all reported syphilis cases. Additionally, individuals who engage in unprotected sex and have multiple sexual partners are at a higher risk of contracting syphilis. Not using protective measures, such as condoms, and having multiple partners increase the likelihood of exposure to Treponema pallidum, the bacterium that causes syphilis. To reduce the risk of infection, the CDC recommends using condoms during sexual activity and undergoing regular health screenings for early detection and timely treatment. The US government has implemented several public health policies to control and prevent syphilis, focusing on community education, providing free testing and treatment services, and strengthening disease surveillance and reporting. Public awareness campaigns have been launched to educate people about syphilis and other sexually transmitted infections, STIs, encouraging condom use and routine testing. Many public health facilities offer free or low-cost syphilis testing and treatment services, particularly for high-risk groups such as MSM, individuals with multiple sexual partners, and those engaging in unprotected sex. Public health agencies continuously monitor and report syphilis cases to track transmission trends and implement timely intervention measures. Under the U.S. Immigration and Nationality Act, individuals with infectious diseases such as syphilis may be denied entry into the country to prevent the spread of the disease within the community. Although these policies have contributed to reducing syphilis rates, the recent increase in cases highlights the need for continued improvements and reinforcements in public health interventions to effectively control the disease. Syphilis progresses through multiple stages, each with distinct symptoms. In the primary stage, the most characteristic symptom is a chancre, one or more painless sores that appear at the site of contact, usually on the genitals, anus, or mouth. These sores may be round, reddish, and prone to bleeding. They heal on their own within 3 to 6 weeks, but the bacteria remain in the body and can still infect others. The latent stage is a phase with no apparent symptoms, yet the bacteria persist in the body and can still be transmitted to others. The secondary stage is when syphilis becomes more evident, with symptoms such as a red or brown rash, particularly on the palms of the hands and soles of the feet, along with ulcers on the skin, mouth, or genitals. This rash is non-itchy and may disappear after a few weeks. Other symptoms may include fatigue, muscle and joint pain, sore throat, fever, chills, and swollen lymph nodes. The secondary latent stage is similar to the earlier latent stage, where there are no visible symptoms, but the bacteria continue to persist in the body. Finally, in the tertiary stage neurosyphilis, the disease can cause neurological damage, leading to memory loss, psychological disorders, and motor impairment. Additionally, syphilis can affect blood vessels, causing aortic aneurysms, and damage internal organs such as the liver, kidneys, and skeletal system. If left untreated, the disease can result in serious complications that have long-term health consequences. The early symptoms of syphilis can be difficult to detect, as chancres are painless and may appear in hidden areas, such as the genitals, anus, or mouth. Moreover, these sores are often small and do not cause discomfort, leading many individuals to overlook them. Additionally, as the sores heal spontaneously within a few weeks, many people dismiss them without seeking medical attention. Early detection of syphilis is extremely important, as failure to treat the disease can lead to severe complications affecting the heart, liver, nervous system, and other internal organs. Additionally, syphilis can be transmitted to others while the infected individual remains unaware of their condition. Timely diagnosis and treatment not only halt bacterial progression, but also help prevent long-term complications and reduce the risk of transmission within the community. Therefore, regular screening and attention to unusual signs are crucial in controlling and preventing syphilis. To diagnose syphilis, there are several different testing methods, including blood tests and tests on secretions from sores. Serological tests, such as VDRL and RPR, are used to detect antibodies against the Treponema pallidum bacteria, although they are not specific to syphilis. To confirm the diagnosis, specific antibody tests such as TPHA and FTA-ABS are performed to identify the presence of antibodies specific to Treponema pallidum. In cases where sores are present, direct bacterial examination using dark-field microscopy can help detect the bacteria directly at the lesion site. Additionally, the polymerase chain reaction (PCR) method can be used to detect bacterial DNA in secretions from sores, offering high sensitivity and accuracy. If congenital syphilis is suspected, doctors may conduct blood tests for both the mother and the fetus to detect the risk of transmission early. Early diagnostic testing is crucial for timely treatment and preventing serious complications. The primary treatment for syphilis is antibiotics, with penicillin being the most effective method. This antibiotic belongs to the beta-lactam group and has the ability to eliminate Treponema pallidum, the causative agent of syphilis. For primary, secondary, and latent stages, a single dose of penicillin injection is usually sufficient to eradicate the bacteria and halt the disease's progression. If the disease has advanced to the late stage, neurosyphilis, the dosage and treatment duration may be extended, and regular monitoring is necessary. For individuals allergic to penicillin, doctors may prescribe alternative antibiotics such as doxycycline or tetracycline. Treatment with penicillin is highly effective, especially when the disease is detected and treated early. If syphilis is not treated in time, it can lead to severe complications that affect the overall health of the patient. One of the most dangerous consequences is damage to internal organs, including the heart, liver, and blood vessels. Late-stage syphilis can cause aortic inflammation, leading to aneurysms or heart failure. Additionally, the disease can damage the nervous system, resulting in neurosyphilis, which can cause memory loss, psychological disorders, muscle paralysis, or even blindness. Another complication is its impact on fertility, particularly in pregnant women, where syphilis can cause miscarriage, premature birth, or congenital syphilis in newborns. Therefore, early detection and timely treatment are the best ways to prevent these severe consequences. When syphilis is transmitted from mother to child, it can have serious consequences for the fetus, including premature birth, congenital deformities, and even death. If a mother contracts syphilis during pregnancy and does not receive timely treatment, Treponema pallidum bacteria can cross the placenta and infect the fetus, leading to congenital syphilis. Babies born with the disease may be premature, underweight, or suffer from severe congenital abnormalities affecting bones, the liver, spleen, nervous system, and hearing. In many cases, congenital syphilis may not show symptoms immediately, but can lead to long-term health problems such as blindness, deafness, or brain damage. Additionally, the risks of miscarriage, stillbirth, or neonatal death increase significantly if the disease is not detected and treated in time. Therefore, syphilis screening during pregnancy and early antibiotic treatment, particularly with penicillin, are crucial to protecting both maternal and infant health. If you are looking for medical services to support syphilis testing and treatment in the United States, there are many reputable organizations and healthcare facilities you can contact. The Centers for Disease Control and Prevention, CDC, provides comprehensive information on syphilis and other sexually transmitted infections, CSIs, along with a clinic locator tool to help you find nearby testing facilities. The Houston Health Department offers testing and treatment services at health centers such as Northside, Sharpstown, and Sunnyside. You can call 832-3935-427 for more information. The Virginia Department of Health also provides similar services with a hotline at 1-800-451-5544 and detailed information available on their website. In Boston, Massachusetts, General Hospital, MGH, has specialized clinics for sexually transmitted infections, offering syphilis testing and treatment. Additionally, Planned Parenthood has multiple locations across the US, making it easy to access testing and treatment services, with an option to find the nearest clinic on their website. Let's work together to combat syphilis by sharing this video. Raising awareness not only helps protect yourself, but also helps your friends, family, and community stay safe from infection. The more people know about symptoms, testing methods, and prevention strategies, the better we can control and stop the spread of the disease. Don't let a lack of awareness put you or your loved ones at risk.